choose healthy foods, and schedule your mammogram. Together, we can make breast cancer a thing of the past.
In our final segment, more new protocols. Researchers are using substances like green tea and diabetes drugs to reduce the size of tumors, while advances in surgery are making things much easier for survivors.
I had annual mammograms, but I skipped 1 year. And in February, I went for a mammogram. Subsequently, I had 2 biopsies, one on my left breast, one on my right breast, and they both had malignancies.
Ellen had early stage bilateral breast cancer. It was necessary for her to have bilateral mastectomies. One of the major concerns that patients have who are undergoing mastectomy is the discomfort or pain associated with the surgery. So the word itself, mastectomy, is frightening. What we're doing here is making the patient experience better by using a paravertebral block. This is a nerve block that's done for the patients prior to surgery so that the nerves to the breast area where we do the surgery are really no longer active.
They told me that it would lessen the pain, and I was definitely for that.
She experienced very, very little pain after surgery. It was actually quite remarkable to have a patient essentially take Tylenol and not really require narcotics. She was discharged the day after surgery. Most patients with bilateral mastectomies with reconstruction will stay in the hospital for several days for pain management.
I had a morphine pump. I think I used it maybe once. I remember Dr. Feldman was very surprised because there was a lot of morphine left.
Encouraging progress, also reflected in research on substances familiar to many of us.
We're mainly interested in trying to evaluate different supplements and pharmacologic drugs that may be used in the future to help prevent breast cancer. Breast cancer is much less prevalent in certain Asian countries, and so we think that there are probably certain dietary components in the Asian diet that may be important. Looked at so far have been soy and green tea.
Rachel Waxman is a participant in this study and works in public health.
I understand from that side of things how the information can help move the field forward.
The green tea formulation that we're using is called polyphenol E. The other drug that we're interested in is actually a diabetes medication called metformin. We know quite clearly that obesity is a risk factor, at least for postmenopausal breast cancer. And so insulin resistance, obesity, diabetes are all very closely linked.
Meanwhile, survivors like Rachel confirm that a diagnosis is just the beginning of their education.
This does end up being a full-time job. Advocating for myself, trying to get the information that will help me understand what's going on. I'm somebody who wants to know, and it's overwhelming, but there are also some great resources out there that help kind of boil down and simplify the information in ways that breast cancer patients can use.
We hope we've given you some good information. Don't forget to join ABC 7 and the American Cancer Society for the Making Strides Walks on October 18th. For more information, call 1-800-227-2345. I'm Diana Williams, and I'll see you there.